This week's Ask Dr. Durie comes from a patient anxious about COVID-19 infection. With all of the news about the new variants and the fact that they are highly infectious but really don't cause much severe disease, the question is, how important is it to really take all the measures that you can to avoid catching COVID-19 infection? And until recently, this was really an unthinkable question for myeloma patients. Obviously, it's important to avoid getting infected. However, since the infections are mild in patients who have been vaccinated and double boosted, for example, and we do have treatments such as Paxlovid, an antiviral therapy for patients who might develop an infection, the consequences of infection are not quite as drastic as they were in the past. However, I would like to emphasize that some of the milder infections where maybe you're not in the hospital, but you're suffering quite a lot of symptoms, these are not trivial. And some patients, maybe as many as 30% of individuals are experiencing symptoms beyond the first 3 months or so. Long-term consequences of having COVID infection, which is called long COVID. And so it is, in my mind, still extremely important to do everything to try to avoid developing COVID infection. And so when you're out and about and you're meeting people that you don't know, when you're in crowded places, when you're in enclosed spaces indoors, especially with poor ventilation, please wear the best mask that you can, N95 type mask, very, very important, so that you can reduce the chance that you will, in fact, develop a COVID-19 infection. And so bottom line is, despite all of the advantages and improvements in the approach to COVID, it's still very, very important to do your very, very best to stay safe and try to avoid COVID-19 infection.